Hi, my name is Xiao Juan. I come from Peking University First Hospital in China. Our paper is about the study of acute encephalopathy in Dravet syndrome, which is published in June 2018 of Developmental and Child Neurology. We know that Dravet syndrome is an intractable epileptic syndrome. Status epilepticus is common in this disease. Severe status epilepticus can result in acute encephalopathy. Acute encephalopathy is characterized by prolonged coma. The mortality rate is high in acute encephalopathy, and survivors left severe neurological sequelae. As for the poor outcome, the need for research on this topic has been advocated. So we performed a retrospective study of our Dravet patients who had a history of acute encephalopathy and summarized the clinical outcome and neuroimaging features. 35 patients of 624 patients were diagnosed with acute encephalopathy. The occurrence rate of acute encephalopathy in our patients is 5.6%. 12 patients died and 23 survived with massive neurological sequelae. The mortality rate of acute encephalopathy in Dravet patients is about 34.3%. The onset age of acute encephalopathy was ranged from 6 months to 10 years old. 31 patients were under 5 years. 34 patients have a high fever when status epilepticus occurred. The follow-up time is ranged from 6 months to 4 years and 4 months. 18 patients had improvement in their motor, language, and cognition. Here is the figure of one patient before and after the acute encephalopathy. It was normal before the acute encephalopathy. 7 days after the onset of acute encephalopathy, we can see marked edema, and during the recovery stage, we can see cerebral atrophy. Here is the figure of another patient. It also showed brain edema in the acute stage and cerebral atrophy in the recovery stage. Acute encephalopathy is a catastrophic complication of Dravet syndrome. The risk factors of acute encephalopathy in Dravet patients are not clear yet. Reported the highest number of cases in acute encephalopathy in Dravet patients. In our study, we found that high fever patients with a severe phenotype such as an early onset age with myoclonic seizures and many episodes of status epilepticus before, and patients under 5 years are potential risk factors of acute encephalopathy. Even though the true cause of acute encephalopathy in Dravet patients are not clear yet, early aggressive intervention of fever and status epilepticus might be life-saving. This is a picture of our team with Professor Dravet. Here, we sincerely thank to Professor Dravet for her advice of this paper. Thank you very much.